Okay, if you're pregnant, you might not want to watch this week's video, and I'll explain why in just a second. Let's go. Hey everyone, I'm Dr. Jennifer Lincoln, board certified OBGYN, and as you know, my channel is the health class you wish you had in high school. Go ahead and subscribe if you haven't already, turn on the bell, make sure you don't never miss any of the notifications, and we're just gonna jump into this week's video, which is the craziest things that can happen during birth. And that's why I led with the whole, if you're pregnant, you might not want to watch this. And you might be wondering, Dr. Jen, why are you making this video? Well, I think it's important that people understand that birth is not always this natural, beautiful, easy process. And I'm not making this video to scare people out of wanting to have kids or, give birth, but to understand that birth can be really cool and also sometimes can be a little scary. And yes, if you're wondering, Jen, are you making this because you're targeting people who say that abortion is terrible and you should never have one and birth is natural? Yeah, it may or may not have influenced my thought on this video, but I also thought, let's talk about these things so people can understand what could happen. And I apologize if this is a really scary video, but we're putting it out there. So let's jump in. Okay, I'm covering 5 crazy / somewhat terrible things that can happen while giving birth, but I do want to lead with these are not super common. Some are more common than others, and I'll talk about that, but I don't want you to think that if you're pregnant and you walk into the hospital, these are all happening to you. That would be terrible. Okay, the first thing I'm gonna start off with that I have definitely seen more of these than the other things I'm gonna talk about today would be 4th degree vaginal lacerations, which is a fancy word for a really bad tear of your vagina. So lacerations, which is tearing in the vaginal canal, very common when giving birth. And in fact, about 50 to 79% of women and people who give birth will have some kind of vaginal tearing. And that makes sense. You're literally pushing something out the size of a watermelon outside the vagina. And we have different grades for these. We call them 1st, 2nd, 3rd, or 4th degree lacerations. With the deeper the laceration is, the higher the number. So most people who have tearing at childbirth will have 1st or 2nd degree lacerations. And those are really no big deal. We can put stitches in if they're bleeding, they heal up almost always just fine. 3rd and 4th degree lacerations are a little more gnarly. And the one I'm talking about today is the 4th degree laceration, which is where you tear all the way through from your vagina down through to your rectum. So it becomes one little, opening. And yeah, obviously not a good day. Okay, and you can see this picture here. I'm looking at it on my computer. Where that person's finger is in the rectum. And you can see how the top part where is the vaginal canal, it's just sort of continuous. And those little circular things on the side, those are different sphincters that are meant to keep poop and gas in, and they've all been torn. So that will be repaired. It can be repaired. It takes some stitches and some time, but as you can imagine, these are not comfortable and have some complications associated with them. The good news is only about 1% of people who give birth will have a 4th degree laceration, so not super common. But unfortunately, complications associated with these kinds of tears are more common. In the first 6 weeks after giving birth, if you've got this kind of tear, about 20% of the time you'll get a wound infection, and about 25% of the time it'll separate or break down a little bit, which sometimes can just heal on its own. Other times you need another surgery or procedure to repair it. And with all of these, you can have higher risks of issues with incontinence, so leaking gas, leaking stool, leaking urine after these, because those sphincters, even though they're repaired, they've been disrupted. And yeah, pain. These things hurt. And so when you go home from the hospital, if you've got one of these tears, you'll definitely be given pain medication like narcotic medicine, which is good for pain, but it can also make you more constipated, which makes it harder to have a bowel movement that's not going to get in the way or mess up those tears. So you also have to take medication so you don't get constipated, and you've got a newborn at home and it's hard. It's really hard. So thankfully it's rare, but for those people who've had one or who have helped somebody who's had one, it's no joke. Okay. If you're totally regretting watching this video, you can stop at any time. Okay, the second crazy thing that can happen during birth is something we call a stat cesarean or an emergency C-section. Some people will use the term a crash C-section. All of these mean not just a C-section, but one that is happening really, really fast. So these are for our emergency cases. So if we are watching your baby's heart on the monitor and all of a sudden it goes down to where it's getting so low it's near death, or if there's an acute hemorrhage, or something really bad is happening where we need to get that baby out right now, either for the health of the mom or the birthing person or the baby, we run back to the operating room really quickly. These are anywhere from like 1 to 15% of all C-sections. The data is kind of all over the place. And these can be really, really kind of scary. So usually we come into the room if there's an issue, we explain it, and we go back to the operating room pretty quickly. If you've got an epidural that's working well enough to use for the delivery, we'll use that. But sometimes you don't have an epidural or we can't get you numb enough quick enough, so we have to put you to sleep. And from the time of us starting, so putting the incision on your belly, to getting the baby out, we can usually get that baby delivered in less than a minute, less than 60 seconds. That's a really, really quick thing. And that's because we're going quickly. And then once baby's delivered, that's when everybody takes a deep breath and then we calm down. And so even in these chaotic moments when we come in and these things happen very quickly, imagine how you feel, right? Maybe you have an epidural, or maybe you've had an idea some things are wrong, your nurses have been worried, or maybe it's very acute and then all of a sudden all these people come into your room and it can feel very overwhelming. I still believe that even in these acute moments when things seem kind of crazy, we can take our time and we can explain them slowly. And so I'm gonna show you what that looks like. Hi there, I'm Dr. Jen Lincoln. I'm the OB. We haven't met quite yet. I'm so sorry to meet you this way, but your baby's heart rate is really low, and I'm worried if we don't deliver him soon, he's not gonna be okay. So we need to take you back to the operating room and do a C-section, okay? I'm gonna talk really quickly, but if you have questions, you just go ahead and stop me, and I'll answer your questions if you've got any along the way. So when we do a C-section, I'm hoping we can use your epidural, but if not, we might need to put you to sleep, okay? If you have a support person like Dad who wants to come back with you, if you're asleep, he can't be back there, but if you have your epidural in place, it'll be totally fine. Risk of C-section includes a risk of bleeding, infection, injury to the organs around where we're working, injury to the baby, and blood clot, strokes, and heart attack. Even in an emergency situation like this, when we deliver the baby, that's when we're going the slowest and we're making sure that he's gonna be A-okay. We're gonna have our pediatric team there ready to help you and be there for him so that when he comes out, if he needs any extra help, he'll be there. And I promise you, we will debrief this all afterwards. And I promise you won't feel any pain. If you do, even if you've got that epidural, we'll go ahead and put you to sleep. What questions do you have for me? I know that's a lot. Yeah, and one other question for you. If you needed a blood transfusion in an emergency, would you be okay with that? Okay, all right. I'm gonna keep talking to you as we go back, but we're gonna get going. All right, let's head to the OR. So that's how I try to keep my patients calm, even though I'm moving quickly, but I know it's not everybody's experience. And it can definitely lead to birth trauma if you don't feel like you understood what was going on or you didn't have a chance to debrief it. So if that happened to you, I am so sorry. And I hope that you got a chance to chat with your provider. Sometimes people need to chat with a therapist afterwards, and I totally understand why. So the third crazy, slightly unfortunate thing that can happen during labor and delivery is shoulder dystocia. This complicates about 3% of births. And this is, as you can see in this photo here, where the shoulder, usually it's the top one, gets stuck. And so the head delivers, but the shoulder can't quite get out because it's underneath one of the pubic bones. Sometimes it's the bottom shoulder, but usually it's the top one. And so we have different maneuvers and things that we can do to try to rotate the baby, rotate that shoulder out of the way. These can be really stressful. And as you can imagine, these are one of those times where, you're managing it and we have protocols and how we do it. We're keeping track of the time, we're calling out the maneuvers, but even like 15 seconds of a shoulder dystocia can sometimes feel like 15 minutes because it's just like, oh my gosh. And there's risks associated with it. So in terms of risk to the mom or the person giving birth, there's an increased risk of hemorrhage, increased risk of tearing, especially as we're having to use our hands to get in there to try to move the baby around. And for the baby, there's increased risk of what we call nerve damage to the brachial plexus because things are getting stretched out. That's why we try to be really careful in how we do our maneuvers, but we do know that we would rather have a baby who is out and getting blood flow to their brain than having a nerve injury, which a lot of times will resolve and will get better. But what's happening when your baby is in that birth canal and that head is stuck is that not as much blood flow is getting to the brain. So the longer it goes on, the more dangerous it is for a baby. Now, there are some crazy maneuvers called a Zavanelli maneuver, which I have never had to do, and I hope I never have to, where you realize this baby's not coming out from below. And you may be trying for like 5 or 10 minutes. And so what you do is you actually reverse all the maneuvers and you try to push the baby back up into the pelvis and then deliver by a C-section. That is obviously when you are just like out of different things to do. And the most wild one is called a symphysotomy. Had to get my handy dandy pelvis to show you this one. So this is where you actually use scissors or a knife, I don't know if you can see that here, and you would cut this ligament here with the goal of being able to then expand the pelvis and get the baby out. We don't really do that. And I will never do one of those. I'm just gonna say it out loud. Like that's just not gonna happen on my watch. Now because I'm an OBGYN, I'm superstitious and I better knock on wood, this is like, you know, the stuff of legends and not things that are done commonly at all. But as you can imagine, the trauma, physical, mental, for everybody, bad, bad, bad. But the good news is the vast majority of shoulder dystocias are relieved and babies come out okay with maneuvers that we can do that are not really traumatic. Oh my God, I can't believe I just said that would never happen. I'm totally jinxing myself. Okay, the fourth thing that can happen at birth and is not good is something called a uterine rupture. And this is what it sounds like. And as you can see this picture here, it's where the uterus has opened up spontaneously. Now, we often think of this for people who've had a C-section before because they've got a scar on that uterus. It's true that they are at a higher risk of having a uterine rupture if they labor again. And this is why a lot of people will sometimes not be offered or will be told they can't have a trial of labor after they've had a C-section. Once a C-section, always a C-section. That's actually really not true. Topic for another day. But you are at a slightly higher risk of a uterine rupture if you've had a C-section before, but that risk is still less than 1%. But yes, uterine ruptures can happen even if you've never had any surgery on your uterus before. And the most common things that we see when there's a uterine rupture are all of a sudden acute bleeding because where it opened up, all that blood flow is coming out and you're bleeding. In fact, fun fact about bleeding from the uterus, every minute, your uterus is getting about half a liter of blood sent to it. So that's what that looks like right here, every minute. So you can imagine if the uterus all of a sudden ruptures and is bleeding, how quickly you could bleed out and not make it if you don't have access to emergency life-saving care. Another sign of a uterine rupture other than bleeding is that the baby's heart rate goes down very low, a sudden increase in pain across the belly, or if the person's pushing or on exam, you felt the baby's head lower and now it's all the way up because the baby's out floating in the abdominal cavity. Now, I do want you to know that having a spontaneous uterine rupture, if you've never had surgery on your uterus before, is really, really rare. My stats say it happens in 1 in every 5,700 pregnancies to 1 in every 20,000 pregnancies. So rare. But it's an emergency. And the way that we treat this is we get you right back to the OR, we deliver your baby, we sew up your uterus. Sometimes we have to do a hysterectomy if the rupture is so bad that we can't repair it. Are you doing okay? I know, I'm sorry, this is not a fun video. Okay, the fifth and final bad thing that can happen at the time of labor and birth, and after this you can go and like watch videos about kittens and rainbows, is something called a uterine inversion. And it's where your uterus basically turns inside out, as you can see in this picture here. So after birth of the baby, delivery of the placenta, you kind of see this weird thing and you're like, what is that? Is that the cervix? Is that a blood clot? And then you realize, oh crap, it's the uterus. It's also rare, between 1 in 2,000 and 1 in 23,000 deliveries. Gotta love statistics that make no sense. But the reason this is an emergency is because, again, you can bleed out very quickly and really go into hemorrhagic shock because the uterus can't contract down, stop all that blood flow. It's turned inside out. You're bleeding. It's a bad day. Risk factors are you've had a really quick labor, you have some kind of abnormal placenta that's stuck to the uterus, and during the delivery of the placenta, it turns it inside out. And there are a few other, kind of rare things. But again, it's pretty rare. I've actually seen it twice in my career. Once there was absolutely no risk factors whatsoever. After the birth, I just remember looking there and thinking, is that the cervix that's come down? And I put a forceps on it and I went, oh gosh, that's the uterus. And I took my tools out and I went right to the treatment, which in this picture I know looks kind of gnarly, but you basically use your fists to put it back where it needs to go. And if it goes back, then you give medicine to contract it down so it stays there. Sometimes that doesn't happen and you actually have to go to surgery and use tools to pull the uterus up from above. And that's not fun. I've never had to do that. The second time I saw one of my colleagues had a birth and it happened to her, and I went in and helped her, and same thing, and everybody was fine. But yeah, it's not fun. Okay, so I just shared like the 5 really scary things that can happen during labor and birth. I want to leave you with this. 2 overall messages. Number 1, these are not super common, so I don't want you to be super scared. But number 2, I want you to acknowledge that these risks do exist, and this is why pregnancy is not a health neutral event, and birth is not a health neutral event, which is why we need access to all the choices for what we want to do with our body. We need access to good prenatal care, access to safe medical services, really just access to reproductive justice and the freedom to decide if this is what we want to do with our bodies. All right, questions, concerns? If you need the number of a good therapist afterwards because you watched this, let me know. Go ahead and drop your comments in the comment section below, and references and resources in my show notes, as always. And if you're not following me elsewhere on social, you can go ahead and do that here. And stay safe, everybody. And again, I'm sorry.